Welcome to this webinar, everyone. It's such a pleasure to have all of you here once again. Here with us, we have our mentors, and some UGHE staff who are interested to attend this session. Let me introduce myself. For those of you who do not know me, I'm Tsion Yohannes, and I'm the chair for the Center for Gender Equity at UGHE, which has organized this mentorship program and the webinars to support this program. Today, here with us, we have 5 distinguished speakers and experts on leadership development discussions. I'm going to introduce them next. Our first speaker is Professor Agnes Binagwaho. Professor Agnes Binagwaho is the Vice Chancellor of the University of Global Health Equity in Rwanda. She previously worked as Executive Secretary of Rwanda's National AIDS Control Commission, as Permanent Secretary of the Ministry of Health, and as Minister of Health. She serves as a Senior Advisor to the Director General of the WHO, is a Senior Lecturer at Harvard Medical School, Adjunct Clinical Professor at Dartmouth. She is a member of multiple editorial, advisory, and board of directors, including the Rockefeller Foundation Board. She is a member of the US National Academy of Medicine and a fellow of the African Academy of Sciences, among others. She has published over 190 peer-reviewed articles and was named among the 100 most influential African women for 2020. Thank you for being here with us, Professor Agnes. Next, we have Dr. Melanie Rabidu on the next slide, who is an assistant professor supporting the evidence-based global health delivery program in UGHE. Having led in vast healthcare delivery roles, Melanie's professional background specializes in practice transformation by reversing underperforming operations through process improvement, fiscal stewardship, and focus on patient-provider relationships. Melanie has her doctorate in organizational leadership from Hood University, where she studied the lived experiences of emerging adult women and their perceived value of primary care and the patient-provider relationship. Melanie also has a master's in public health in policy and a Bachelor of Science in Public Health from the University of Maryland. Melanie has received Pain Business Journal's Future of Healthcare Award and is a member of the Society of Women Geographers, among others. Thank you for being here with us, Dr. Melanie. Our next guest is Natalie Munyampenda. Natalie is the Chief Executive Officer of Kepler, which is building a global model of accessible higher education and training in Rwanda by focusing on a competency-based model that emphasizes technical and soft skills and job readiness. Prior to Kepler, Natalie was managing director at the Next Einstein Forum, building Africa's community of scientists and publishing for science-driven industrialization through foresight and policy work. Natalie has also worked in Canadian and Rwandan public service and has degrees in international development and graduate degree in strategic communications. And thank you for your presence in this session, Natalie. Our fourth speaker is Mr. Ahadu Gabramlak, who is the Managing Director of Center for Africa Leadership Development. Mr. Ahadu is a leadership development consultant and a learning facilitator, trainer in organizational development and leadership, and a legal and business consultant. He holds an MA in organizational leadership from Eastern University in the US and an LLB from Addis Ababa University. He has various professional certifications such as coaching from European Mentoring and Coaching Council on Leadership Essentials from Center for Creative Leadership and many others. He has consulted over 100 organizations, including the World Bank, International Trade Center, USAID, the British Council, Management Sciences for Health, PACT, Ethiopia, IRC, John Snow, Packard, and GIZ, among others. Again, I would like to thank Mr. Ahadu for his role in this panel. Our last speaker is Dr. Joanny Marlene Bewa, who is a multi-award-winning physician from Benin Republic and a public health research associate at University of South Florida College of Public Health. Dr. Bewa founded the Young Beninese Leaders Association and has received various awards, including the First Lady Michelle Obama Young African Women Leaders Grant. She is appointed as a United Nations Young Leader for Sustainable Development Goals and also serves as a board member and chair in various organizations, including Merck for Mothers and Young Women Caucus of the Continental African Women Leaders Network, among others. Dr. Bewa was featured by Melinda Gates on her list of 6 influential women on the topic of global access to contraception in 2016, and is recognized for the One Campaign Women of the Year award. Dr. Joanny has a doctorate degree in medicine, master's in public health from the University of South Florida, USA, where she's currently pursuing a PhD in public health. Thank you for being here with us, Dr. Bewa. Now, I would like to introduce today's session. As you may have seen from the title, we are going to focus on leadership discussions in the context of mentoring programs. And I'm sure most of you are going to find this session very interesting. And I look forward to your active engagement throughout the discussions in the chat box and so on. Professor Agnes will start the session by opening remarks, following which we'll have presentations from each of our speakers on topics that are relevant to leadership skills development in mentorship program. Dr. Milani will give us the first session, followed by a presentation by Ms. Natalie on the role of mentors in the development of leadership skills. We will then have a session by Mr. Ahadu on types of leadership development models and his reflections on UGHE's mentorship program. The last session, which is very important, will be on the measurement of development of leadership skills that will be delivered by Dr. Bewa. I will also have a discussion session at the end of the presentations. So I encourage all of you to attend, to type in your questions in the chat box, and we'll address those questions at the end of the panel. And now I would like to invite Professor Agnes to open the session on why such a webinar is important for our audience. Welcome to the Professor Agnes.
Thank you, Tsion, for this wonderful presentation and presentation of the panelists, but also presentation of what we are going to discover today. So dear panelists, mentors and mentees, it's a pleasure to have you in this mentorship webinar organized by the University of Global Health Equity by our very active and productive Center of Gender Equity. It is a follow-up of the webinar on the development of learning objective in mentorship program. We bring to you a session focused on leadership skills. I would like to welcome you once again to what will be an engaging session. And I would like to thank our esteemed speakers, and they come for a varied field, and normally this session is going to be very interesting, like Tsion have told us, very engaging. And this webinar will share with us the knowledge and experience and expertise of those panelists. So, as you all know, the University of Global Health Equity focus on teaching students not only on clinical skills, but also to equip them with leadership and managerial and communication skills. All this is crucial for being a successful global health leader. This is crucial to change the world and contribute to change the world for the world we would like to see. This is why today, the Center of Gender Equity at UGHE is hosting a webinar focused on leadership within our mentorship series. A leadership-focused webinar is important for our mentors, but also for our mentees, for many reasons. We believe that leadership skills and what we can learn are not only meant for mentees, but also for mentors, for all of us. Such a leadership session will help you, all of us, to identify what it means to be a leader, how to explore your needs, determine how to enhance your success at your work, in your life, personal life and professional life, as well as to find the tools to lead your work and to lead others, because a leader is a person who can create and nurture leaders. And to become the future global health leaders we all hope you will become soon. This session will also enable you to have an idea about how to attain your bigger vision. We encourage all of you to identify your needs and challenges so that you can work on those while also strengthening your existing qualities between mentors and mentees. This is what is about. We also want this session to help you examine who you want to be as a leader and what qualities you would like to possess. As we explore important topics such as the development of learning objectives and leadership skills, we want these sessions to have an impact on your career beyond the mentorship period. With that being said, I hope you will actively apply this lesson in your career and even in your personal life and in your leadership journey. It is a pleasure to welcome you once again to this webinar series, and I hope that you will learn a lot from the distinguished panelists we have put with you together, thanks to Tsion work. And they will be with you today to discuss all those crucial subjects. Thank you, and I now invite Tsion to guide us through this discussion. Back to you, Tsion. Thank you.
Thank you, Professor Agnes. Indeed, the importance of such a webinar is clear, and we believe our audience will benefit a lot from this engagement, and even us as organizers are going to enjoy and learn a lot from these presentations. Professor Agnes has another meeting midway through our webinar, and we will excuse her then, but I'm happy that she's able to join us today and to follow through the presentations of our distinguished speakers. Thank you, Professor Agnes. And now, I'd like to call on Dr. Melanie to take us through what leadership development within a mentorship program looks like. And welcome to the podium, Dr. Rabidu.
Wonderful. Hi, everyone. Can you hear me okay?
Yes, we can hear you.
Am I good? Okay, wonderful. Thank you, Tsion, Professor Yohannes, and team. It brings me so much joy to be included in this conversation, a conversation about mentorship, or as I like to say, leadership in action. In a moment, I want to share with you a quote as a placemat for discussing leadership in the context of mentorship. I don't know about you, but I've always had a hard time finding a definition of leadership that I could really resonate with. For example, some popular definitions of leadership include leadership is service, or leadership is influence, and everything in between. And you can also say leadership is mentorship. From my perspective, these definitions are not wrong. I just feel like it's not the whole story. And I'm always asking myself, when we put action to leadership through service, through influence, through mentorship, what is that action in pursuit of, and how do we get there? So Laura, if you're able, and you don't mind, can you please bring forward the slide for everyone to see that kind of talks about what leadership is? All right, wonderful, thank you. So one day I was scrolling through my Instagram stories and this quote came across from Brené Brown. And it says, "A leader is anyone who takes responsibility for finding the potential in people and process, and who has the courage to develop that potential." What I would like to do is unpack this quote through the lens of leadership as mentorship, and to get us thinking about how mentorship puts leadership into action as we aim to lead with compassion and less for compliance. And I believe Laura can paste the quote into the Q&A box so that way you can track with me and refer back to it. All right, wonderful. So starting from the top, a leader is anyone who takes responsibility for finding the potential. Let's just stop there for a moment. Let's focus on the scope of anyone. Leadership is not linear. It's not a transaction. meaning a mentee is as much of a leader as a mentor when engaged in the mutually beneficial mentorship experience. As leadership as mentorship is relational, therefore it's reciprocal. And it also mentioned responsibility. Being a leader is not easy. Taking responsibility for something requires investment of our time, our talents, and our treasures. And because you can see the potential, you can find the energy to lead in this way from within. It should really come from the heart. So therefore, think about the why behind what called you to be a mentor, what called you to be a mentee, and what potential did you see? I know here at UGHE, we take responsibility for finding the potential in pursuit of equity. So moving along, a leader is anyone who takes responsibility for finding the potential in people and processes. So this is the anchor to the definition that really spoke to me. A good leader needs to know the difference and interrelations between people and process because everything functions as designed. And what I mean by that is when a mentee and mentor are discussing an opportunity for improvement, it is crucial we can distinguish between a process failure versus a people failure. So think about those mentoring crucial conversations that you may have had. How are you tackling the forces of institutionalized systemic processes versus maybe solely trying to fix the person in front of you? Productive and results-focused mentorship experiences should ensure people are set up for success. Personally, I think the biggest barrier to effective leadership as mentorship is our tendency to miss the forest by focusing too much on the trees. Finally, in summary, a leader is anyone who takes responsibility for finding the potential in people and processes and has the courage to develop that potential. Leadership as mentorship takes courage. You are dealing with people and processes, so it's gonna be messy. Hence, developing that potential we see in each other and processes takes commitment. It takes a devotion. When you are mentoring, to be steadfast in your devotion, it's best to lead with compassion versus lead for compliance. The only way to develop that potential you see is having more questions than answers. Mentorship should invite conversation, dialogue, and it takes courage to do that. It takes courage to set aside the urge to have the answers or to feel like you have to always have the answers. And it takes compassion for each other and one another and for yourself. So I leave you with this. To the mentees, don't ask or expect your mentors to provide a prescription. Mentorship is a development tool, not a magic wand. You work the tool, don't let the tool work you. Therefore, to the mentors, give yourself permission to be more curious than certain and develop that potential with compassion. And this is just the tip of the iceberg, so I look forward to your questions and comments, which I encourage you to enter in the chat box. So thank you, and back to you, Tsion.
Thank you so much, Dr. Melanie. It's great to hear your reflections on the definitions of leadership and what it means in the context of mentorship. And a great quote, I say, a mentee is as much of a leader as a mentor. Thank you also for reflections on finding potentials, identifying barriers, which I believe are great points to start our panel with. And I would like to thank you on behalf of the audience. And for the audience, I would again like to remind you to send your questions in the chat box. And now we will go into the next session, which will discuss the role of mentors in the development of leadership skills. I would like to invite Natalie to take us through this session. Welcome to the podium, Natalie.
Thank you very much. I'm very happy to be here and thank you for the invitation. So I just want to jump right in to make sure that I'm keeping time and so that we have time for questions. We could go to the next slide. I think the question I think that is very important to ask yourself is that oftentimes people mistake mentorship for coaching, and coaching is in general has a very targeted window and is done usually by somebody who has some deep training in this area that is able to assess you and review exactly where you need some support. And a mentor, as Melanie already mentioned, is a long-term process, and it is a relational process where you don't always have the answers. I think that's a very good takeaway. And your objective is not to prescribe, as she said, to find a problem and prescribe a solution. It is more to help the person that you're mentoring talk through some of the challenges that they have and offer them a wide range of possibilities based on your own experience. So I always say that you as a mentor are not coaching, because the person that you're with probably should at some point get their own coach based on their, as Professor Binagwahu mentioned, identifying their own needs. And I do recommend everybody take a coach, but I'll come back to that on why I mean. Next slide. So one of the main factors with mentorship is that when we talk about relationship, it means that you have to understand sometimes why different people make decisions. And so we, I am not an expert in this area, but I lead a team of 80. And the bigger the team, or at least from my perspective, even if it's a small team, people make decisions based on their own experiences, their background, their trauma, their priorities at the time, and we'll talk about that when we talk about values. And so the mentor must have a personal relationship with the mentee. Now, this can be very challenging in an area where, in countries where there's different context, and asking personal questions might seem forward. And so there has to be a good balance where the mentor takes, and I use mentor because I know that even the mentees are already mentors or will be mentors. There has to be a personal relationship, and you have to find a balance in how much you're asking about people's lives. So for example, a very good example I like to use is that your mentee might be pregnant and very sick. And so they're saying a lot of professional things, but there's also a personal strain that is causing them to have a very difficult time at work. And so it's important to know these things at the pace and the comfort of the mentee. Next slide. Okay, so the bottom line for me is that leadership is about how you're experienced. It's one of the things that my leadership coach has ingrained into my head, and it really brought something to the front for me. It's how people experience you. It's not so much about what you know and what you say. It's how people feel when they're dealing with you. And that basically comes up from values. What is the why? What is your driver? How you manage people, how you interact with people, when and what you communicate, especially under stress. The technical knowledge you bring. You'll notice that I put technical knowledge at the fourth, because people experience all those things before they understand that you're very knowledgeable what you're saying. And then how you lead through crisis. And we're seeing through a pandemic, this is very important because how you manage under pressure affects how you communicate. It affects how you treat people, and it demonstrates your values. Next slide. Okay, so I wanted to say 3 quick things about how mentors can help mentees. The first thing is, I think I did a really in-depth personality test that was very useful for me. So I had done all these, free tests that you do online, but it's important to take some time and encourage your mentees to do a personality test, because once I got a better reading of myself, I could lead from a strength instead of a weakness. I know that there's a lot of talk about leading from weaknesses. That's not going to happen. You're probably going to improve your weaknesses by 10%. So you should be leading from your strengths, and it's important to know your strengths. And I had always gotten the wrong type of personality test, so I spent a lot of time miserable about myself and the fact that I couldn't live up to what I thought was supposed to be my personality. So I think that it's important for mentors to, on a professional scale or even a personal level, to understand their personalities. So take a personality test with a coach so that they can explain some of these things, and encourage them to take regular 360s. I like anonymous 360s. I think 360s people should actually tell you how they experience your leadership. Next slide. Number 2, help mentees understand their current values. So drdemartini.com, if you go on there, it's a very, very simple exercise. And here they're not talking about values in the sense of integrity or equity. Here they're talking about where I am in my life. What is it that I value? Is it a paycheck? Is it a title? Am I pursuing another degree? Where am I in my life? And oftentimes, especially women, we do not want to acknowledge our values because there's a lot of assumptions. So, a couple of years ago when I made a career change, it was purely about a monetary reason. I wanted to be better paid. And it's important for mentors to make it okay for mentees to tell themselves the truth about where they are right now and what are your values in that sense. Is it a better position? Do you want to move to a new, more challenging role? Do you want to reduce the amount of challenge you're dealing with at work? Next slide. Number 3 is you have to help mentees through your own experiences. And so there's a tendency when you're a mentor to want to give mentees the best of yourself, but this is not useful for them. It's important to talk about the good and the bad, and particularly the bad. And oftentimes we have to be very careful that you're not talking over mentees and you're not talking too much. But it's important to talk about the experiences that have made you a great leader. So when we look at someone like Professor Binagwaho, I can tell you her experiences as Minister of Health were very significant, but they were also many lessons through failure and hardship. And so it's important to talk through and not say, now I encourage you to do this. It's more like, this is what I have done and this is what I have learned, and let the mentee be able to pull for themselves what they need. And most importantly, encourage people to lead through their strengths. I think while they're working on their weaknesses, they should be aware of their weaknesses, but this should not be the focus of where they're working on. Next slide, and I'm almost done. Yes, so before you mentor, it's important to understand the mentee's context. You know, my initial mentors were people who had never been on the continent in Africa, and oftentimes they're telling you things that you should do that really would not work here. So it's important to understand the context in which people are living and working. And so if you say, oh, you know, why don't you go up to the CEO of the hospital or the, you know, and tell them how you feel, this is not how it works here. So it's important to listen and learn about the context and provide contextual advice or mentorship. Next slide. Very good. I think the last point is I want to talk about inspiring confidence. It's important for mentors to inspire confidence in mentees. And it's very important to understand that no one is born confident. You get confidence from this. I had just this training recently with my own senior team. Technical expertise, experience, preparation. I think that it's very important, even if you're preparing what you're going to say. I'm very happy that UGHE is talking about how you communicate. Even until now, even if it's my background and I teach speech writing and public speaking, I still prepare every single time I'm going to open my mouth, because I know I have a weakness of rambling and telling stories that should not be told. And so I have to discipline myself in that way, and I write everything down and follow it as much as possible while I'm telling stories. The other one is self-motivation. It's very important for mentors to constantly remind mentees that they are there because they deserve to be there. And the second part is encouraging mentees to look and feel good. And that can vary. But the two things is that they deserve to be there and that they should be working on making themselves feel good in where they are. I think that that's all I had today. I don't know if there's another slide. Yes, and I always say that besides encouraging and inspiring confidence, the job of a mentor is also to open doors. Thank you.
Thank you so much for this presentation, Natalie. Great points on the different ways that mentors can help their mentees, the importance of personal relationships with a mentee, the balance between the personal and the professional, the importance of focusing on strengths than weaknesses. And another great quote from this presentation, leadership is how you are experienced. Thank you so much for this session. I'm very excited to hear from our last speaker, Dr. Joanny Marlene Bewa, on a very important topic. That is, how can we measure the development of leadership skills, given that it is an important tool to determine whether we have achieved our goals or not. Welcome to this panel, Dr. Bewa.
Thank you. It's my pleasure. So I will dive into the presentation right away. And I want to focus specifically on how we can measure leadership skills in the context of global health, but also other development issues. So next slide, please. So based on my research, but also my engagement in the leadership roles from chairing a board. Right now, I'm the interim chair of Women in Global Health that has over 24 chapters globally, focusing on global health work and gender equality, or leading community nonprofit work in Benin, or actually trying to influence policy making at the global scale. I've kind of get to learn a little bit more what a leader is and what a good leader is. Everyone can be a leader, but a good leader actually needs to have a vision and purpose, needs to be able to inspire and motivate others, to make sure that he uses his power, his influence to actually impact his community or her community and make a positive change, not just a change, but a positive change. Actually has interpersonal skills, able to lead by example, has empathy, is disciplined, has integrity, but also can mentor, invest in others while celebrating others' successes. But overall, I think what is the most important is that a leader is a human. And that humanity is something that we always need to put at the center of everything we are doing. Next slide. So before I kind of start talking about how we can measure leadership development, I wanted to bring up a little bit more information about how we can access leadership actually. So there are a couple of tools that are out there that are evidence-based, that has been experimented for many years actually. And I just decided to focus on two or three of them to get to know a little bit about how you as an individual, as a mentee, or even as a mentor, you can assess your leadership ability, you can assess your personality, but also see how it first match or not, or get close to what your mentor is in terms of leadership and personality, or what your mentee is in terms of leadership and personality. So the first one is the DISC, D-I-S-C. It actually measures your tendency, your preference, your patterns, behavior. It's not about intelligence or performance per se, but it's more about your patterns and behavior and your leadership and personality. So the D means dominance. So people who have the D personality, they are more likely to be confident, and then they have an emphasis on accomplishing bottom line results. I is all about influence. So they are more likely to be open, and they emphasize on building relationship, building trust, influencing and persuading others. As personalities, steadiness, they are more dependable. They have an emphasis on cooperating with others and being sincere and beyond. C, personality, consciousness, emphasis on quality. Is this accurate, bringing their expertise and the competency on the table? So as you can see, people can be a D and they have a little bit of E, of I, right? People can be C but has a little bit of S. That's why when you do your DISC profiling, you will find like a point which will show you, or you was likely to be D, but you also have some I or S skills actually. Next slide. The second one that is I found interesting and that I use it less than the DISC is the Enneagram. So the Enneagram is also really useful for people to get to know about their personality. It's more like a personality test. So for example, those who are mediator, you will find that, well, you are a mediator, so you might be more inclined to be in situation where there is conflict resolution, for example, or you might feel more comfortable, being in situation where there are difficult conversations and negotiations on the table. People who are performers, when there's tasks related to let it get down quick, fast, and very good. So you will have, performer type will feel very comfortable, and it's going to be even easier for this type of person. Someone who is a giver might be more comfortable in settings or activities that are related to helping people, like nonprofit work or advocacy or corporate social responsibility, for example. Those who are, let's say observer, they will be more likely to look at, well, knowledge, knowledge and kind of get to observe and get to understand situation a little bit more. Next slide, and I have a link there where you can actually take the Enneagram test for free. The DISC profile is more likely or is interesting when you have a group. So if you want to assess, how people are different within a group, of course, they will take the individual DISC test, but it helps you actually to see group dynamics. So you may want to not put 2D dominance as co-chairs all together, right? Because you know that it's not gonna work. But you might want to have, for example, a D dominance with an I influence, you know, together, so that they kind of bring in this type of expertise all along. And the third one that is also very, very, very useful and is more inclined to individual assessment will be the Clifton Strength Finder. So it's all about an evidence-based, you know, personality test as well, but also more leadership inclined, where the focus is on 4 domains: those who are executing, those who are influencing, those who have more like relationship builder, and those who are strategic thinking. So when you look, for example, you take the test, it will give you a series of questions. And I also have a link where you can take some part of the test for free in the slide. If you will receive a ranking of the top 3 or top 5, I think when I took it was the top 5 strength, personality strength and leadership strength that I had. And then, for example, the achiever, they will be more likely to be into let's make it work, let's be productive, let's, you know, get some results. Those who are futuristic, for example, they will be more likely, okay, this is what is happening today, but how do we project that into the future? How do we plan ahead for 5-10 years based on now? They are in the present, but always projecting the future. So if you have a position, or you have someone who wants in the future be in a position where they actually want to work about the growth of the enterprise or the growth of the program, you want to have someone who has a strong futuristics actually team. When you look at people who are analytical, they are the critical one. They want to think about things. They want to actually think about, well, what is working, what is not working, how can we improve this? And they will kind of think a lot, they kind of put pieces together. And if you have something that needs to be very detailed, you want to have someone who has analytical as one of his key priority themes to kind of be assigned to that. You will have people who has connectedness, you know, as a key strong team. And then there's a little bit more about, you know, connecting with people, you know, building linkage with others. So it's kind of good to have at least one or the other assessment tools for you as a mentee or as a mentor. And then you can even compare where you both are in terms of the DISC or maybe the Clifton, and kind of see first how your personality and your leadership match. But also as part of the team, you want to know that to kind of see how you can work together. Next slide. I don't think we are hearing the audio right now. Maybe the host want to unmute himself or herself. While the video is coming up, it's actually just a video to get a glimpse about an achiever.
I think it's incredibly helpful if you've got achiever to really understand what we mean, how we define achiever, what the science behind Clifton Strengths suggests that theme of talent includes. You'll notice some things like a whisper of discontent. That's one of my favorite sentences in that definition. There's always something more that can be completed. Achievers as leaders might have a little bit different of a definition than they do as individual contributors. If I'm an achiever, I can manage my to-do list by checking it off. I might wake up in the morning, starting every day at 0, looking forward to what can I complete. Now, if I'm a leader of other people, I might use that in a little bit of a different way. I can be a pace setter, helping other people understand what we as a collective need to complete. I can be an energizer, using that engine sort of from the back rather than from the front and helping cheer people on. I think it's incredibly helpful if you've got achiever to really understand When we think about strategic, it is about sorting through clutter, noticing patterns, and being able to sort very quickly to the best route forward. It's not a skill that can be taught. So if you've ever been told you need to be more strategic, probably a good way to press back and say, okay, what really do you mean by that? When we talk about strategic, we think about a very distinct way of thinking. People with high strategic tend to notice patterns, play out alternatives, and then continue to ask, what if then? I think about strategic sometimes, and Carol Ann McGuire this week posted a really great picture of strategic that had a whole bunch of arrows. It looked almost like a flow chart. And I think about strategic often as that way, being able to play out scenarios, not just what's the next step, but what will be the residual effect? What will be the step after that, and then what will we do? So if you're someone with high strategic, you discard those paths that lead to nowhere. You really do look for relevance or perhaps even efficiency. It's also a lot about culling and making selections until you arrive at the best strategy or the best path forward. So a lot of the definition of strategic is understanding it's not just thinking carefully. I think sometimes we use that word to mean thoughtful or even critical. When we think strategic as a Clifton Strengths theme, I want you to think about somebody who asks, who thinks about options, who sorts through options, usually quicker than others, who asks what if and if then.
Thank you for projecting those videos. Those videos are the property of the Clifton Strength Gallup team. It's not my property, so I want to acknowledge that. I will take the remaining 1 or 2 minutes to kind of talk toward how we can measure changes in leadership. So there are 3 steps that I suggested. The first one is you want to set some benchmark, some leadership competencies or requirement at the beginning of your program or at the beginning of your initiative, so that you can refer back to those leadership competencies, which can be qualitative or quantitative, measurable indicators, and then measure the change based on those benchmarks. The second one is to identify how you want to evaluate those, the change in leadership development. So do you want to conduct some, qualitative assessment? Do you want to conduct quantitative assessment with surveys about how likely do you think you'll grow in terms of mindsets at the beginning of the program, for example? Or qualitative, you will want to think about how confident do you feel about being able to lead a team. Very confident, not confident, or a little bit confident, like some Likert scale measure. And the third step would be, after assessing, after measuring that, you want to provide feedback, right? And give opportunities to actually, for the leader, the mentee, to actually grow. So I will, in the next slide, I will kind of emphasize a little bit more on a couple of areas that you can tap into for the leadership competencies. Next slide. So I found these 2 very useful, the McQuaig 360 Leadership Review that has 8 leadership competencies, of course, that can be tailored to any industry or to any program specifically. But I thought, questions to kind of evaluate leadership change can actually focus on those 8 competencies, both from a qualitative standpoint or a quantitative standpoint. So for example, assess the mentee ability to initiate choices, for example, and direct people toward it. Looking at how they feel confident or how they have supported others in the organization. Looking at how they're engaged. Measuring engagement level is so critical in terms of leadership, how they connect with other people, how influential they've been, how they've been into negotiation spaces, for example. The technical expertise and the knowledge, how do they feel like the knowledge has improved from the beginning to the end of the program? That might be subjective as well, but there might also be some objective measures to assess knowledge and technical skills. The ability to conceptualize. So during a program, where they're able to conceptualize a program or an initiative or to innovate, to kind of bring some puzzle pieces together. Did they develop results? Did they deliver specific results? For example, if your mentee is, for example, working in a program, let's say, in a program that aims to reach 500 people, and they are the key lead, you want to see if at the end, with your support, they really deliver the result of reaching 500 people, or if, for example, they reach 550 or 450. But also how they adapt with change. We are during a pandemic and we've seen the disruption that happened. So change management is something that is really critical. How do they adapt to change in a situation where, for example, there's been a drastic change in the work environment or even in the school? And the performance piece is also very critical, and it comes together with the technical expertise as well. Next slide. So I think to kind of just finish up here, there is this book that I found interesting. I haven't read it yet, but I plan to read it, The Measure of a Leader. So I actually give a couple of specific insights about how to measure leadership. To sum up, I think there are different ways following the three-step approach that I'm suggesting: setting benchmark regarding competencies and a requirement, evaluation method, which can even be qualitative or quantitative or mixed, but also looking either at objective or subjective indicator, for example. And finally, identify opportunities to provide feedback to the mentee, but also provide opportunity for growth. These links will help you assess a couple of tests that you can take for free: the DISC, the Myers-Briggs that I didn't talk about, the Jung test, the Big Five personality, and other tests that you can take for free. Again, thank you for your time. I went a little bit over time, that I thought it was really important to expose you guys to those type of tools. And yes, let's continue this conversation. Thank you.
Thank you so much for this session, Dr. Bewa. It is very interesting to hear about the different tools, the DISC profiling, the personality tests, and even the team testing team strength. I really find it interesting, even beyond professional development. This is really relevant for personal development, and I'm sure our audience will find it as such. I would also like to thank you for the list of resources, links here that you shared on your slides, and we will share those with our audience in our newsletter as well. Interesting videos as well. Thank you so much again, Dr. Bewa. We're now at the last session, which is the discussion. Here with me, I have some questions which were picked from the chat box. Let me read them. The first question goes to Natalie. It reads, you mentioned about leading by strengths, but not focusing too much on our weaknesses. The question is, can spending less time focusing on our weakness minimize the opportunities to work on those areas of improvement?
That's a good question. I think that it's important to understand what your strengths are. And the reason we say lead by strength is when you're leading, you have to lead with what you do best. This does not mean that you are also unaware of your weaknesses. It's important to understand your weaknesses. In fact, when you do a thorough personality test, and preferably with a coach, in general, they will talk to you about what are your strengths and what are your weaknesses. And the reason I said you shouldn't spend your time on your weaknesses is, research has shown that you can only take your weaknesses so far, but you can give yourselves some tools to be able to do that. For example, if you are a talker and your issue is that when you get excited or when you're leading, you're confident, you can provide direction, you're able to galvanize people to action. Oftentimes you talk a lot, therefore you're not listening enough. And when you're leading people, it's very important that everybody's able to speak and be heard. And a good trick from that, for example, is to speak last. And so when you're in a meeting or you're interacting with your team, you ask everyone, what are your thoughts on this? And you make sure that your opinion comes last. So leading from your strengths is understanding what makes you stand out and unique, and how you can help the people that you're leading. But also understanding your weaknesses allows you to put in tools and mechanisms so that you can manage yourself. That's, I think, the big item there. How do you manage yourself is really understanding your weaknesses and putting in mechanisms to manage that.
Great, thank you. The second question goes to Dr. Melanie. Is it beneficial to have a predefined list of desired leadership skills, or is that limiting to the mentee? What do you think of this, Melanie?
Oh, Melanie or Natalie? Sorry.
or even the other speakers can respond to this as well. Is it beneficial to have a predefined list of desired leadership skills, or is that limiting to the mentee? What are your opinions on this?
Yeah, I think it's a good question. I think it goes back to Natalie's point about strengths-based leadership. You can't be everything to everyone, or you'll quickly become nothing to no one. So when you think about like, what are you trying to get out of the experience? What type of leadership skills do you want it to develop or really enhance or invest in? It has to be contextualized. I think it has to be contextualized to yourself as a person. So it's really important that you know yourself, but also within the environment that you're working in. And I will say a lot of the leadership measurement systems are conducted and the efficacy of them have been tested in the United States. So sometimes it's really hard to generalize outside that context. So just something to think about. But when you think about what you're trying to get out of the experience, what are these core competencies or expectations of what a good leader is? I think Dr. Joanny said it best, where there's a leader, but then there's a good leader. So you can do all of the activities of being a leader, but it goes back to in pursuit of what? And hopefully it's in pursuit of goodness, right? In pursuit of equity, et cetera. So being a good leader looks at your skills, what you bring to the table, but more importantly, how you're surrounding yourself with good people. And then collectively, we're doing that thing that we're trying to all achieve, right? So I think it depends, if that makes sense.
Thank you, Melanie. There's also another question for Natalie. It says here, let me read it. She has said that mentors have to know the context and the current personal lived lives of the mentees, which indeed is necessary. What advice can you provide to both mentors and mentees? For mentors to be able to understand their mentees, and for mentees to open up and tell their dark stories so that they can be helped. This is a question for Natalie, but I think anyone else can also respond. Let's hear from Natalie first.
Sure. I think I'm not, given the people on the panel who deal with mental health and other health, I'm going to be very cautious here. But I think what's very important here is that the mentee is usually the one who should set the pace of what the mentorship experience is like. And I think it's very critical. I think I wanted to tag on to what Melanie was saying there. The mentor is not to provide a kind of a textbook. This is what's going to happen, day one, week one. It's basically getting to know someone and listening. As Joni talked about, what are leadership and how do you assess? I often say that it depends on where the mentee is in their career. And so if it's someone who's just starting and or is just starting to manage people, I think you have to talk about, you have to listen through what they're saying and get to know them and ask questions that allow them to also determine what it is they want. Oftentimes the temptation is to guide. And I said that that's what coaches do as opposed to what mentors do. And so I think you have to, with the mentee, and it can be a very honest conversation, what is it that you want to get out of this process? Many of us have had people approach us and say, hey, I would like you to mentor me. And that first discussion with mentees, when I decide if I can provide them what they need or not. Because they're telling you, what is it exactly? And it might be, I find you inspiring, but beyond that, what do you want to get out of this experience? And so asking very poignant questions. I do not think that the mentor should seek out dark secrets. I think that by listening, you're able to understand where people are, especially if you yourself understand what makes a great leader. Oftentimes mentors are mentors because they have more experience, life experience in terms of age, and also work experience, but that doesn't make you a great mentor. You have to also know what makes a good leader and listen to the aspects, what they're telling you. And then for people who are much more senior, even my own team, I always ask, how is your team doing? How is your team taking this information? And often if you listen and you hear that this person is not talking about people on their team, you have to kind of say, hey, I understand you're doing so well, you're producing so well, how is your team doing? And I think that those type of questions allow conversation. And remember, you even if you're assessing how the mentorship is going, it's really a relationship where you are trying to influence, not so much direct action.
Thank you, Natalie. The next question is from our own UGH team for Dr. Bewa. As leadership development is ongoing, how can the process started by the mentor during the mentorship be measured after the mentees have left the program? Interesting question. Would you like to respond to?
Sure. That's a great question. I'm actually putting together a proposal to evaluate a leadership and mentorship program. And one of the things that we really wanted to focus on, because for that program, there was some set of benchmark that was identified at the beginning of this leadership program. But one thing that is critical is first to look at indicators about the perceived growth that the mentee actually is gaining through the mentoring program, the perceived benefits. And these perceived benefits can have indicator about, well, let's talk about how did that impact you in terms of productivity? How did that impact you in terms of decision making? How did that impact you in terms of taking initiative and leading? But also how did that impact you in terms of confidence? You know, so those kind of quality indicator you can also put there. The whole piece about the team morale is really important. How do you feel like this program, this mentorship improve your interpersonal skills, for example? And I really like a couple of items that Natalie and Dr. Melanie highlighted about building on your strengths. So by assessing the leadership skill, the leadership capacities, and the personality at the beginning, you can have a little bit of a benchmark as well to kind of not put the mentee in a box, but actually get to understand those are the strengths, right? And we want to also at the end measure how they did well on the strength, but also we found that they might not be necessarily strong in the influence team or in the relationship building team. And we want to see maybe at the end of the program, if they felt like they have improved on those areas. You also want to ask open-ended questions, you know, like which area of the program you think we need to improve to help you reach your goal. So to kind of summarize, I think there is this whole assignment that needs to be done at the beginning of the mentorship program in terms of identifying what is the goals that you want to achieve through the program, what is the goal that the mentee want to achieve herself or himself through the program. Those are a couple of indicators that you want to measure at the end, and do maybe a pre and protest that in terms of methodology, either looking at the point that I mentioned earlier, or maybe tailoring the 8 leadership competencies that are projected so that you can do a pre and post assessment. I think that's a little bit, the suggestion that I can share to any mentorship or leadership program, and also really help you to measure not just quantitative items, but we also remember that relationships are not just about numbers. So that's where I advise people to actually also have a lot of qualitative questions, open-ended questions, so that they can really measure level of engagement, satisfaction, confidence, interpersonal skills, etc.
Thank you so much. And we have another interesting question. Can one agree that mentorship is not part of their strength and decline to be a mentor, or is it something a leader must work to do? Who would like to respond to this?
I can tackle that. I think you should decline mentorship often, because I'm assuming the more you become a leader, you get lots of requests. But I think that what is key is that as you become a leader, you actually become a mentor and a coach to people that you lead. And so mentorship is not a thing you can avoid. And I think there's a misunderstanding that if you are a shy person or an introvert, that you make a bad mentor. So, you know, some people mistake mentorship for motivational speaking. This is not what mentorship is. And so no matter your personality type, whether you're an introvert and it's very important to understand that if you're leading teams, you are mentoring, and it's important to be good at it, because there is some benefits for the people that you're leading. And I do believe as a service, as we're good citizens and good people, as good humans, as Dr. Johnny was talking about, it's important to go out of your way to also mentor. I think especially if you are a woman in leadership and you know that you've had a difficult path or a challenging path, it's important to be able to turn back and pull some people up with you based on your own experiences, but also just briefly not to lead in the same way that you were led. Sometimes we think that we need to lead through suffering, and that's a very, it's also the same thing as thinking motivational speaking. We have to turn back and also gracefully pull people up because hopefully it's getting better now.
Thank you. Interesting discussions. Anyone who wants to add on this?
Yeah, Tsion, I don't mind adding. I'll kind of back into the question. I think Natalie gave a great overview. And I'll start with, I think everyone can think about positions of authority, right? And sometimes we automatically assign those people in those types of roles as leaders. And I think that's not always the case, right? When you think about the definition of leadership, it's how we invest in the potential we see in others and processes. And maybe it's unique to me, but I've met a lot of people in very high up positions that I think are doing good work, but I wouldn't necessarily qualify as leaders for a variety of different reasons. And mainly it's because they're not reaching back down and they're not having that ripple effect of what they're doing kind of spread. Mentorship is like a modality of leadership. It's how you live out leadership. And there's other modalities to leadership, like we talked about. There's influence, there's service, there's friendship. Mentorship is a very specific way you can invest in the potential you see in others and in processes. I think to Natalie's point, it's very conducive to leadership, so they can almost be one and the same. And if you find yourself struggling with being an effective mentor, that's a good conversation to have with yourself and probably maybe your mentors or your coaches or people that, feel your experience or how they experience you. Because if you're struggling with mentorship, that's probably indicative of something else. So I would just say there's a difference between kind of saying, I don't want to be a mentor because I'm going to do my job and I'm going to do it as an individual contributor or a follower. But if you truly are invested in being a leader, it's not something you can avoid, like Natalie said.
And I want to agree with Natalie and Dr. Melanie about, the importance of, giving back as much as you can, but also being mindful of the fact that if you are very busy and you don't feel like you really can't, please do not, because there will be frustration from both parts. However, I think it's always great to accept challenges. If you feel like you would like to do it, but you don't feel equipped, you don't feel skilled to do it, the learning by doing for me is a really, it's a big deal. I think people can learn by doing if there are clear guidance, and there are clear expectations, and there are clear mentorship manual, and there are clear documents, people can definitely perform. So I think if it's just about not sure about performing, I think it's okay to accept new challenges and kind of, just go for it and learn through the process. But if it's about not having the bandwidth time-wise to dedicate to it, I would just say, do not do it.
Thank you. I'm happy to see that Mr. Adu has rejoined the call. And the next question is directed to him. Then it says, I want to hear from you some of the strategies that would be helpful to keep the mentorship program more engaging, mainly when it has to last for long. What are your thoughts on this, Adu?
Yeah, I think this is a great question. What's this relationship for me is the drive out of it. So long as the mentee is benefiting out of the relationship and growth is happening and real-time issues are addressed in that process, I think it's the relationship. So the quality of the relationship between the two is not necessarily based upon the mentor's skills and qualities. It's a relationship thing. The chemistry and process needs to be really something that serves the purpose and the context. And I think it boils down to the value the person gets out of the relationship. So I've been in mentorship for many years. I've worked with dozens of young, especially from like 20 years back. Some of them really still keep in touch with me for the past 15, 20 years. I have dozens of professionals I mentored when they were entering the professional life, but because of the kind of heart I had for them, the care and the support and the patience that helped sustain the relationship for so many years, like 2 decades. So I think it's basically also the kind of handling you have on the issue and the relationship.
Thank you, Mr. Hadu. I think we are left with a few minutes, but we have one more question for Dr. Bewa about the DISC grouping profile. Are there skills under any of the groups that every mentor should have?
Well, I will say that there aren't necessarily specific skills. However, people who are like D dominant personality, more likely to be D. Then again, I said, when you receive your score, you will have kind of a gray area where you have leaning more toward D, but you have some I and some C actually. So it's not gonna tell you just you're only D, but will tell you are dominantly D or you are predominantly C, but you have some I and S are actually characteristics. So you've asked, the dominants, the D people, they would be direct, result-oriented, very strong-willed, very forceful, right? The one who have the I, the influence, they will be very outgoing, enthusiastic, optimistic, high-spirited, high-level. So if you want, people who are in a position of, building relationship or influencing and even management or high-level negotiations type of thing, you will want to have someone who has some influence, right? And do it effortlessly. Those who are S, steady, they are more likely to be very patient, accommodating, tactful, humble. So conflict resolution, for example, or team dynamic, they might be best positioned for that. Those who are more like the C type of person, conscientiousness, they're analytical, they are very reserved, very precise, very critical thinking, very private, very systematic. They will have an archive of everything that you guys have been working for the past 10 years in different folders. So it actually will describe people more specifically based on their personality type and the leadership skill that comes with it. As you want to build on your strength, then you already know that those are areas that you want to keep building. But as a mentee, those are areas where if there is any opportunity requiring those skills, you want to position yourself because you're going to be effortless. But if there are any capacity building opportunities coming, you want to prioritize the area that you are not necessarily the stronger in. So I think that's how you want to interpret the days. But also for team building, for a team, DISC is one of the best tools to use to kind of assess individual leadership and personality skill, but also to build team so that you can bring different expertise and different personality together.
Thank you, Dr. Biwa. Maybe just one more quick question for Ahadu. There is a question about efficacy of mentoring during the time of Corona, because face-to-face mentoring and observing is more effective. And the participant asked, what magic formula can one pull to ensure one is giving the best to mentees during challenging times like this?
I think this is a very relevant and critical question. I don't think there is any magic formula or a silver bullet that would address the issue, but I think big ears, listening heart, caring, so a Zoom meeting or Skype, whatever, Hangouts, work so long as people really speak out their heart to bounce off some ideas and really connect at a deeper level that would help move things. Yes, it's not an ideal scenario. I like, for example, working with my mentees in a garden or in a street or sit in a cafe and chat, and the context, the eye to eye, all that adds a lot to the mentoring. But at the same time, when you strip it down to the usefulness of listening, meaningful conversations going on, and insights transpiring out of that conversation. So so long as you manage to do a meaningful conversation through technology, I think that's manageable. It adds a lot of value, even during Corona.
Thank you, Ahad. And I see more interesting questions coming up on coaxing, shy mentees, and so on. But in the interest of time, we will respond to this through email. I'm sure all of you are now inspired to read more about these topics, the leadership models, role of mentors, and how we can evaluate the development of leadership and so on. I'm very grateful for our distinguished group of speakers in our panel, and on behalf of the audience, I would really like to thank you for your engagement, your time, your knowledge and experience shared. The Center for Gender Equity is really appreciative of this. I would also like to close by noting that for those who are interested to follow some of the presentations online, a section of the recording will be available on YouTube, Facebook and Twitter channels. Please follow on this for further information. With this note, I would like to close the session till we convene next time. Thank you, everyone, and have a good evening. Thank you.